Hi, I'm Will. I'm a junior doctor in the NHS, currently working in the southwest of England. I'm here with Amar Shah, who's going to tell us a little bit about what you've been talking about today at the conference and how things are going. So, how's it been going today at the conference?
Yeah, I'm really pleased to be here chairing the forum in London for the first time in the last 8 years. It's returned back to London, and it's in East London today, which is where I practice and work as a doctor, as a forensic psychiatrist, and lead the health system here, which looks after people's mental health and community health in the community. Today is really the pre-conference day, so we've had a whole range of different sessions, 18 sessions in total, allowing people to go out and see examples of improvement in practice in the field, but also to learn some topics in a bit more detail through workshops. I've been running a couple of workshops today already on the topics of scale and spread. So how do you take an idea that's worked in one place and really enable it to work in other places to the same level of effectiveness? And right now we're in the middle of a workshop on why QI often doesn't work. So trying to understand the reasons why quality improvement doesn't achieve the results it does as often as it should. Trying to explore that so that we can keep learning how to improve better.
Fantastic. And what have you been telling people? So, what would be the key take-home points from your talk about why QI doesn't work sometimes?
I think when we've looked at the literature and we've talked to people who are in this field, four key things come out for us. One is thinking about the environment in which change is happening. If we don't really pay attention to the environment and the culture of the team and making sure people have what they need around them to do the work, it's unlikely to succeed. There's another factor around how we design improvement. Like, are we really being rigorous about the use of the method? Just like in research, we wouldn't expect to see good quality findings if we didn't apply a proper method. I think the same thing applies in improvement science too. The third is really checking that we have the constituent parts to sustain improvement. Like, are we really building it to last rather than just to be a temporary effort? And the fourth component that we seem to see a lot of is data. Like, have people got access to the data? Are they using it in the best possible way to guide their improvement? So those are the four things we're deep diving into today to help people learn how to improve their improvement practice.
That sounds really interesting. So, for people watching the video at home, what kind of things might they be able to do to help them to improve the way that they practice quality improvement?
So I think the first thing to do is not try to do this by yourself. I think lots of people have described failing improvement work where they haven't had buy-in from the whole team, that this is the thing we really want to work on all together. That multi-stakeholder involvement is really important. The second thing I think is to do this together with the people we're serving. We look back at 500 improvement projects in my organisation, East London Foundation Trust, and actually there was a really strong correlation between the projects that had full co-production with people with lived experience and their likelihood of success. They were 2.8 times more likely to achieve their aim than projects that didn't have that level of involvement. So who's involved is really important. Making sure you've got the time to do the work, because it takes a lot of effort to improve the system. So you need that permission and the time to be able to do the work. Apply a proper method and make sure you've got support and leadership around you. I think those would be the critical things. If you're going to do this, it's hard work. Make it count and put the effort in right at the beginning to make sure you've got all of those things in place.
Fantastic. And it sounds like it's a team effort, so you need lots of people around you who are involved. So, and getting those people on board is obviously really important as well. So, final question from me, as someone who's interested in mental health and wants to be a psychiatrist in the future, as someone who's a consultant psychiatrist now, could you give me some examples of good quality improvement within the field of mental health?
Yeah, of course. In fact, I would go so far as to say some of the best quality improvement work in this country now is in the field of mental health. I'm biased, I know, but looking around the field, there are some really good, rigorous examples of quality improvement work being applied and delivering results. You've just got to look at, for example, the work we've done over the last few years on restrictive practice. Trying to reduce the use of restrictive practices when people are at their most vulnerable in inpatient settings, being able to do that at scale across the whole country, leading to tangible reductions. The work we did just after the pandemic with 25 different organizations to increase people's well-being, staff well-being, and their joy in work at the tail end of the pandemic, when most countries around the world were describing increasing burnout. Through the use of quality improvement, those 25 organizations and those 40 teams saw burnout reduce, saw people's joy in work increase. And that's simply by giving people the tools of quality improvement to understand what really matters to me in my work. How can I make sure that we are taking control of the things we have some control over and some influence over to make our lives better at work and to focus on the things that we really care about. So being able to demonstrate safety improvement, being able to demonstrate joy in work, being able to demonstrate better flow. There's a big national program at the moment in the country with teams all across the country working together on improving flow, really making sure we do the maximum we can with the capacity we've got, the resources we've got, to meet people's needs earlier and better. So I think there's some fantastic examples of mental health QI work.
Fantastic, and I would say from a personal perspective, being involved in flow and being a junior doctor in hospitals, it's one of the things which I feel really contributes to burnout. So if working on those kind of things, I think is really important in improving not only patients, but improving the staff who work around them, and hopefully patients in turn as well.
Oh, totally. I mean, quality improvement gives you a way to understand the system you're working in, realize that there are some things we can actually do about it. We're not passive recipients of the system. We don't just need to complain that it doesn't work for us. We can actually do something about it. And we might not be able to control everything, but we can definitely make a difference.
Fantastic, and as a junior doctor getting involved, I think that empowerment feeling is really important as well. Thank you very much for speaking to us. I'll let you get back to your talk, and thank you for watching.
Thanks a lot.